Hello and welcome to another episode of Pilates Elephants with your host, Raphael Bender. Glad to be here with you today. We are doing this episode live. So if you're joining us live, glad to have you with us, and whatever platform you're on, whether it's Instagram, Facebook or YouTube, you can type questions into the chat stream and I will see them here. So love to have your questions, your comments, your feedback. Don't feel like you need to wait to the end. Let's make this interactive. If there's anything that pops into your brain, I'd love to dialogue with you. So what I want to talk about today are the question, which skills do you need to confidently teach Pilates to anyone? Now, I'm going to make a case that I think there are 5 key skills of a Pilates instructor. And I think that we spend too much time, as a general rule, on repertoire. And I've said this before, but I think that, historically, a lot of us, and I've been this person, a lot of us think everything's a nail when it comes to Pilates. And the hammer that we have is learning more repertoire. So we think, I want to increase my confidence, so I'm working with injuries, so I better get more repertoire. I want to, get more clients and make more money, better get more repertoire. And I think that's a mistaken approach. Now, I love the repertoire. I, know all the repertoire. We teach the classical or the contrology repertoire at Breathe. So I'm a fan of the repertoire, but I think it is not I think there are other core skills that I think are relatively neglected, and certainly were neglected in all of the training I participated in as a student in Pilates. And I'm pretty sure most Pilates educators don't teach a lot of these skills. So the things that I think are the key skills to be confident to teach Pilates to anyone are, number one, the exercises. Okay, so yes, you do need to know the exercises, but I want to talk about this more in a minute. Next one is cueing. The third one is programming. The fourth is prenatal, and the fifth, or pre and postnatal, and the fifth is injuries and pain. Now, there are other things that you can learn, like behavior change, goal setting, business, etc. But I think these are the core skills to walk into any situation, whether it's an in-person group studio or a one-on-one situation, or teaching online, teaching in a specialty sort of boutique environment where you have, clients with particular needs, or teaching in a more general sort of fitness-based Pilates situation. I think these 5 skills of the exercises, cueing, programming, prenatal, and injuries are the sort of the 5, pillars of skill that we all need to be confident to teach Pilates to anyone who walks through the door, or even if they walks through the Zoom room. So I want to talk about each of these a little bit in turn. Again, if you're watching, if you're live, I'd like to have your questions, your thoughts, your input as we go along. And hopefully, if the technology cooperates, they will pop up in my chat here. So firstly, I want to talk about, a little bit about the exercises. And I think the elephant in the room, or the Pilates elephant here in relation to the exercises, is the notion that we need to know all the exercises. There are 34 original contrology matwork exercises, 37 if you add in the series of 5 from Romana. There is something like 45 reformer exercises, depending on whether you include things like head and so on, 45 give or take. And then there's all the Cadillac and the chair and the barrels and the pedipule and the toe corrector. And, all of those additional things. And it ends up being, I did a count one time a few years back. I think there's something like 550, something that I counted, exercises in the full Pilates, system. And of course, that number is going to be different depending on whether which exercises you classify as truly Pilates, or, is the prep for an exercise an extra version, or is it just the same exercise? So, so 550 is a rough kind of sort of number. And I'm sure we could have a long and interesting debate about what that number is, but I think we could all agree it's a lot. And I think that, I remember when I was doing my certification, when I was training as an instructor, the biggest, thing that I was focused on was learning all of the exercise and learning the breath patterns and the choreography and whether the toes were flexed or pointed and, all of that. And I think, all of that has its place, but the amount of time and effort that we spend on it, I think, is not commensurate with the result that we get for our clients. Now, I don't know about you, dear listener, but in a decade or more of teaching, I found that even though I knew all of those 550 exercises, now I knew them because I was teaching them. Like I was teaching people to be teachers, right? So we went through all of the repertoire and multiple times a year, on weekends and in intensive courses. So, I have learned all of those exercises and probably still could, smash out 450 of them reasonably easily. Not in terms of like my amazing physical abilities, but just in terms of remembering the choreography and the breath patterns and all of that kind of stuff. But what I found, dear listener, is I probably taught about the same, about like 20 exercises to almost every client, right? I mean, is this your experience? Like, do you basically find yourself teaching like the same, pretty small list of exercises to almost everyone? Everyone gets some version of footwork, some version of, arms in straps, some version of, the 100, whatever it might be. Well, that was my experience. And when I looked around the studios that I worked at and, when I talked to other instructors, that's what their experience has been as well, by and large. So I'm guessing it's probably your experience as well. Now that's not a bad thing. It's not a good thing. It's just a thing that I've observed seems to be for the majority of instructors, that we end up just like teaching really like 20 or 30 exercises most of the time, or, variations on those 20 or 30 exercises most of the time. So, what is the benefit of learning all of those 550 exercises? Well, there is a benefit. I think, understanding the full system and how the exercises kind of work together, is a value add. But I would argue that the amount of time that it takes to learn that, particularly at the start of your career, or if you're not feeling, confident with certain client situations, like if someone is pregnant or has an injury or, can't do a certain exercise because they don't have range of motion or strength or whatever to do that exercise. Well, I think if you're lacking confidence in those areas, learning more exercises won't solve that for you. So I think once you've got those kind of 20 or 30 exercises, which are not going to be the same exercise for all of us, but, they're going to be like simple, big movements that are applicable to a broad range of people to strengthen the whole body and move the body through range of motion. So I don't know what the exact list is for you, but for me, it's going to be footwork, lunges, long stretch, arms in straps, legs in straps, lying on a box, pulling straps, teaser, like these simple exercises that are, I just find myself pulling out pretty much every time I have a client on a reformer. So that's what I'm going to argue are the main things that we should focus on. And once you are very confident teaching those exercises, I think the things to focus on are the other four pillars: the cueing, programming, pre and postnatal, and injuries. So I want to move on to each of those in turn now. So, and I'd love to know if you are, either in the live audience or if you're listening to this as a podcast on your favorite podcast app, or watching it on YouTube, or watching the replay on a social platform, DM me or hit the comments and at me. I'd love to know, like, is this true in your experience? Do you have a relatively short list of exercises that you basically teach to everyone and everyone gets some version of footwork or, arms in straps or the roll up or teaser or whatever it might be. All right, so on to cueing. Now, when I was learning Pilates, I learned this. Cueing, really, there were kind of two things that I learned because I learned in the Stop Pilates system. The first one was to always cue the 5 biomechanical principles of Stop Pilates, which were breathing, pelvic placement, ribcage placement, scapular stability, and head and neck placement. And so in any exercise, you would always cue, start by cueing the transversus abdominis and the blah, 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 and all of those principles. And then there would be, like the specific instructions that you give for each exercise. So we kind of learned this kind of generic framework of how to cue, which was the 5 basic principles. So we'd always cue by, okay, inhale to prepare, exhale, gently lift the pelvic floor, flatten the abdominals, and then blah, blah, blah. Do the movement of whatever the movement is for the exercise. Lift your leg, curl your head forward, whatever it might be. And so there were kind of specific word tracks for each exercise. So, you would learn, the breath pattern and all of the, you basically would memorize a spiel for each exercise. Whereas I think, what I've learned over the ensuing, decade and a half is that the job of teaching Pilates, as in to teach is to facilitate learning. To learn means relatively permanent changes in skill over time as a result of practice, getting better at doing the thing. So to teach, what we need to do actually goes beyond cueing. Cueing is one part of teaching. And so I think the elephant in relation to cueing is that, we need to cue the muscles every time the client, moves, because, if we think about any kind of learning situation, like think about just being in school, like in grade school, primary school, when you're learning, to spell, the teacher might, call out the spelling for the word, the first time you learn it. Here's how you spell cat, C-A-T. But if the teacher is still calling out C-A-T when you're like a senior in high school, like there's a problem. You should internalize that knowledge, relatively early on. You should not require that the teacher literally spell it out for you every time you write the word. And in fact, we don't require that the teacher spell it out for us, because if learning takes place, we now own that knowledge ourselves and we don't need to be reminded of it. Maybe every now and then we make a mistake, then the teacher needs to bring that to our attention. Okay. But the teacher doesn't need to spell it out every time. Whereas in Pilates, we kind of have this, I think, this mythology in a lot of styles of Pilates, certainly I think a lot in contemporary Pilates, that, which is what I was trained in originally, that, teaching in quotes means telling, naming the components of the exercise, like C-A-T, breathe in to prepare, breathe out, gently contract the pelvic floor, flatten your lower abdominals, et cetera, et cetera, et cetera, right? So, and when I see videos sometimes online of people like, teaching the exercise, I look at the person doing the exercise and sometimes they're doing it brilliantly. Like they're obviously very skilled at doing Pilates, but yet the person teaching the exercise is still telling them like basically C-A-T. So, dear listener, no knock on you if that's you, because that was me for many years. But I think, just in terms of a common sense approach to how people learn, we shouldn't be doing that beyond like, the third day of somebody's learning an exercise. So once they've got the CAT, okay, I think there are more things that we can do to facilitate learning as a teacher, rather than just somebody who is like a tape recorder that plays a recording every time somebody does, we want someone to do a certain movement. So I think the three things there that are, clearly come out of the literature on motor learning are building the expectation of success, giving autonomy, and using external cues that are related to the outcome of the movement. Now, I've spent a whole episode, probably more than one episode, talking about these things. Go back to my episode interviewing Gabby Wolf and Rebecca Luthwaite. I can't remember which number it is, but if you just search down, it's like fairly early in the archive, and we'll probably link to it in the show notes. So we talk about exactly how to do that and a lot of the research around why those are the important things. So I think cueing and is a pillar, but I would actually broaden it out and say like how to teach movement skills rather than cueing, because I think cueing is like one part of how you teach movement skills effectively. The other two parts are building expectation of success and giving autonomy. The next pillar is programming. And I think the elephant in programming is that it's hard and time consuming. And probably I think this is one of the top two. This is probably the second biggest thing that I think people, share with me that they're struggling with. So when I've, for instance, like surveyed my Instagram followers or, my email list or current students or whatever, this is the thing that people second biggest thing after prenatal, which people stress about. And what stresses people about programming, I think, mostly is how long it takes to do it. I have people saying they spend hours every week, programming their sessions, and that it's very, very time consuming and hard work. And so I think that the good news is it can be really, really simple. And you can, in fact, program a session in under 60 seconds. Like you can program a great, 60-minute long Pilates session on one or many apparatus that works the whole body through all ranges of motion in all directions at an appropriate level for whatever level of the fitness the client or clients in the class have. And you can do that in under 60 seconds. And it's very, very simple. Now, I don't have, time right now to go into how to do that, but I think there are, we've developed at Breathe a very simple framework, which Heath and I have talked about a couple of times. And there's an episode, again, I can't remember which number it is, but the title is "There Are Only 3 Exercises in the World and Cat Stretch is 2 of them." Something like that. And we'll link to that in the show notes. And that talks about our approach to programming and how to do it very, very simply. So really, essentially, like the basic gist is, we think in terms of body positions rather than, individual exercises. So rather than thinking I'm going to start with this exercise, then move on to this exercise, we just think like, okay, we're going to start in supine, or we're going to start in standing, or we're going to start in prone, or we're going to start in 4-point kneeling. And then we just think like, okay, what are a series of movements we can do in that position, starting from very easy to and progressing gradually to very hard. So we start with, say, 4-point kneeling. We might start with like cat stretch, which is a super, basic exercise that pretty much anybody, with, relatively normal health can do. And then we'd progress it from cat stretch to a slightly harder version, maybe lifting one leg or maybe, hovering the knees. Or, how would we make that slightly harder? And so we just, gradually make it harder, make it harder, make it harder. And then after you've done like 5 to 7, versions, you move on to a different body position. Maybe go from 4-point kneeling to prone. Okay. And then we go, okay, what's a really easy prone exercise? What's a slightly harder prone exercise? Slightly harder, slightly harder, slightly harder, slightly harder. Okay. Now we roll over to supine. Bam, rinse and repeat. So we think in terms of like a series of layers or progressively harder exercises in a body position. So rather than thinking about individual exercises, we think in any given session, you're doing a 60-minute session, you might do like 3 or 4 or so, body positions. And so all you're thinking is like, oh, I'm going to do quadruped, supine, prone, side lying. Bam, there's my 4 positions. Okay. And when you do front, back, and sides, you've done all of the muscles, right? Prone, you work your back muscles. Supine, you work your front muscles. Side lying, you work your side muscles. So we've worked all the muscles if we've done all of those positions. So it's really, really, really simple. Now, it's not really simple necessarily the very first time you try to do it. Like anything, riding a bike. First time you do it, not very simple. But when you've done it a fair few times, it becomes really, really simple. And this is the same with programming using layers and clusters like body positions, like I just talked you through, is it becomes so easy and so simple. You can literally program a 60-minute class in under 1 minute. Okay. Programming. I think, there are a couple of sort of other sort of slight sub points that I'd like to make on programming. The two things are, one is I think we almost universally underload people in Pilates. And what I mean by that is in order to stimulate a strengthening effect, and adaptation in the body, the primary stimulus is a high level of mechanical tension on individual muscle fibers. And we only experience that in the final half dozen or so reps before failure. And failure is where you literally cannot continue. So if you're doing push-ups, and you get to a point where you're like, oh, I can't do another one, that is failure. So the last 5 or 6 or so reps before that is where you're actually getting a strengthening stimulus, right? So if you can do 30 reps of an exercise, like say footwork, for example, and you only do 20 reps and then stop, you're probably getting almost zero strengthening stimulus. Probably pretty close to zero. Because the strengthening stimulus happens in the final half a dozen reps before you hit failure, right? So that's the reps where you really start to slow down, or if you're in a plank, it's where you start to really shake and you start to sag a little bit in the middle. So if you're not getting your clients to that point at least once in the class per movement, front, back, sides, okay? If you're not getting their front muscles to that point at least once, their back muscles to that point at least once, their side muscles to that point at least once, and their leg muscles to that point at least once, you're not providing a strengthening stimulus. So we need to either do enough reps that the client gets to that point where they just start to slow down and it's really hard to proceed, or we need to increase the load, right? Add more springs or take off more springs, as the case may be, or just add more lever, lift the knees off the ground, or whatever it might be on the mat, so that we get to that point where it's the last few reps before failure. And you don't have to go all the way to failure, but if you stop 2 or 3 reps before failure, you will get a strengthening stimulus. Mostly in Pilates, that doesn't happen. And the final thing is the principle of specificity. So exactly what you train is exactly what you get good at. If you want to get good at doing a split, practice a split. If you want to get good at doing push-ups, practice push-ups. All right. Programming. The next thing I want to talk about is prenatal. And I find, this is, by a mile, the number one topic that Pilates instructors seem to feel inadequately prepared for, or, have a lot of curiosity and anxiety about. And I think we've devoted several episodes of this podcast to prenatal, so I don't want to spend a lot of time on this here, but I think the elephant is that it needs to be scary or complicated, or that there are special, lots of special rules for pregnant women. My 30-second summary of how to teach pre and postnatal Pilates, although, go and listen to the 3 or 4 episodes, just, search our history for the word prenatal, or pregnancy or diastasis. We've got a bunch of episodes on all of that. The 3 simple rules for, pregnancy-friendly Pilates sessions are no prolonged supine work after 20 weeks. Okay. Avoid overheating and stay hydrated, and avoid falls risk. Right. Now, there's a 4th one, which is not actually a rule, but it's just kind of like a common sense thing, which is maintain comfort, right? Which doesn't mean you have to prop everyone with a bazillion bolsters and cushions and blankets. It just means if they don't enjoy doing the half rollback when they're 30 weeks pregnant, just don't have them do that. Have them do something they enjoy more. And that's going to be individual, and each woman's going to have things, that she does or doesn't like that are, somewhat unique to her. So you just have to ask, hey, how do you feel about doing the half rollback today? And she'll go, yeah, that's fine. Or she might go, yeah, I don't want to do that. Can we do something else? So yeah, no prolonged supine after 20 weeks, avoid overheating and stay hydrated, which is like, this isn't like avoid ever raising your body temperature. This is like avoid, significant increase in body temperature beyond what you would get with normal exercise. So as long as you're exercising in a thermoneutral environment, like a air-conditioned Pilates studio, right, you're perfectly safe, and avoid falls risk. So don't do splits on a low spring, don't stand on BOSUs, etc., unless you have something to hold on to. And even then, it's like, why take the risk? Do splits with 1 foot on the floor, and you don't need to stand on a BOSU. So that's prenatal, and it really is that simple. Dear listener, please, if you're unconvinced of that, go back and listen to one or all of those previous episodes on prenatal. And the final pillar, I want to talk about of the 5 key skills of Pilates instructor is working with clients who are injured or who have pain. Now the elephant, I think, in relation to this is that pain and injury are the same thing. I think most people assume that or are taught that. It turns out that it is not the case. And that what you see on scans, things like disc bulges, disc degeneration, meniscal tears, rotator cuff tears, labral tears, etc. What you see on scans are not necessarily injuries, and they're not even necessarily that related to pain very much or at all. And the final elephant there is that there are special exercises for each of those things. Which exercises for labral tear, which exercises for disc bulge, which exercises for a disc degeneration or stenosis or whatever it might be. Now it is the case that for a very small number of conditions, there are specific movements which might be more helpful than other specific movements. But those are absolutely the edge cases. And for the vast majority of conditions, from the extremely mild to extremely serious, there are no special movements that are good or bad, just like the same movements that are beneficial for everyone are beneficial for people with the condition, whether the condition is disc bulge or cancer or, diabetes or, whatever it might be. The exercises that are going to benefit that person are basically the same movements. I'll give you a couple of examples. Let's think about disc bulge. Someone with a disc bulge who has back pain, there is no specific exercise which is going to be of more or less benefit on average for people with disc bulge than any other exercises. We've looked at exercises from really every corner of the available literature, from heavy deadlifting to unloaded multifidus activation to spinal stabilization to walking to yoga to mindfulness to breath work to general fitness programming in a gym to like core strengthening and hip mobilization. Like, we've looked at all of these things, and what we found is again and again and again and again, everything works just as well as everything else. There is no one best or worst exercise for somebody with a disc bulge who has back pain. That's very, very, very clear in the literature from literally hundreds of studies. Which is great, because it means that like just getting moving has a lot of benefit for people, and it doesn't really matter what particular movement they do. So you might as well just give them a general workout, like we talked about in the programming section, where you're doing the front, the back, and the sides, okay, and bringing all of their muscles to a point relatively near to failure, like within 5 or 6 reps of failure, okay, they're going to get the full benefit. right? There is no special exercise. If we think about something like a rotator cuff tear in the shoulder, any loaded arm movement is going to load the rotator cuff. And in fact, the more load in the arm movement, the more load you're working against with a big arm movement, the more load will be on the rotator cuff. So you don't need to do special exercises to isolate your rotator cuff. You can target the rotator cuff just fine by doing a push-up or a plank or a rowing movement or any other loaded arm movement. So you don't need a special exercise. And in fact, none of those special exercises have been shown to be any more effective at rehabilitation of people with shoulder pain, whether it's rotator cuff related shoulder pain or painful arc, what we used to call shoulder impingement. There's no exercises have been shown to be more or less beneficial for people with these conditions. So really, literally any loaded arm movement is going to be of benefit. Same as with disc bulge. And we see this again and again and again in the literature for multiple different conditions that you don't need to do special exercises for each condition. Just be sensible, avoid excessively aggravating symptoms. And that's where I kind of just want to spend the last minute before we finish up here is on injuries that, for, the skills that we actually need, I think, in relation to injuries are we need three basic skills. The first skill is the ability to screen for red flags and acute injury, right? So there are, if somebody has a broken arm or, a disc bulge that a traumatic injury, to their back that is 48 hours old, okay, or some other acute injury, okay. Well, yes, there are movements they should avoid in that situation, okay, and they probably should avoid all movement in that situation. So we do need to be able to identify people who have an acute injury, the tissue is still healing, and either refer or, modify for those people appropriately. And modifying is very simple. Just okay, don't do anything that hurts. So if you think about the person who sprained their ankle yesterday, it's do you have to send them to the emergency room? No. I mean, unless it's very, very, very severe. But it's can they still do class? Yes. But they probably don't weight bear on that ankle, right? So just do single leg footwork. Everything else is going to be fine, right? You can use your arms, you can use your abs, you can use your back, all of those things, just as long as you avoid aggravating that injured, body part. So just common sense, model there. So, but we need to be able to identify people with acute injuries versus those with persistent or chronic pain, right? So that's a rule. That's a skill we need, is to screen and identify those people with acute injuries and red flags. Second thing we need to understand is pain management, or in other words, what I would call the 24-hour rule. And 24-hour rule says that for people with chronic pain, okay, so we've ruled out the people with acute injuries, they're not in the room anymore, or they're avoiding loading their injured part. So for everybody else, the 24-hour rule says that pain with exercise is perfectly safe, okay, because pain and injury are not the same thing. And when you have pain, it doesn't mean you're causing damage. Pain with exercise is perfectly safe. However, if symptoms stay elevated for more than 24 hours after a session, do less at the next session, right? So if it's more painful during, that's okay, as long as it's tolerable. But if it doesn't settle within 24 hours after the session back to pre-session levels of symptom, that just means you pushed a bit too hard, right? So back it off at the next session and proceed a bit more gently. So that's the 24-hour rule, right? Pain during a session is fine as long as it's tolerable. This is for people once we've ruled out acute injury, okay? Pain during a session, tolerable pain during a session is fine as long as it settles within 24 hours. If it doesn't, back it off next time. And the third thing that I think is important for us to understand in relation to injuries is that rehab is very, very simple. It's just graded exercise to restore strength, range of motion, and control. And I think actually the last couple of weeks I did an episode on that. So there is an episode called Rehab is Just Graded Exercise, a couple of episodes back, if you want to hear my thoughts on that. So, dear listener, I think, in summary, I think there are 5 key skills of a Pilates instructor to be able to confidently teach Pilates to anyone who walks through your door or into your Zoom room. I think those pillars are the exercises, cueing, programming, pre and postnatal, and injuries. And I think that, when by and large we spend, a disproportionate amount of time on on exercises in the Pilates world, and we probably, for most of us, if you're feeling underconfident in, working with any particular clients or, in some aspect of your teaching, rather than learning more exercises, like if you already know 20 or 30 exercises that you can string together into a class that will work the front, the back, and the sides of the client, you know enough exercises. And I think your time would be better off analyzing those 4 remaining skills, cueing, programming, prenatal, and injuries, and thinking, okay, where are my gaps in those 4 key pillars, and go and seek out specialist, learning in those key pillars. And for the love of God, dear listener, don't go and learn repertoire for those things. Don't learn like the repertoire for prenatal or the repertoire for injuries, because then it's just like the same thing, the problem repeating. So learn the principles, learn the frameworks of how to work with prenatal clients, how to work with injured clients, how to program. So if you already know 20 or 30 exercises, and that will, work all the major muscles of the body through full range of motion, forwards, backwards, and sideways, enough exercises. What you need to know are principles in relation to cueing, programming, prenatal, and injury. So I would say have a sit down, do some reflection, grab a cup of coffee, think about where are the gaps for you in those 4 areas, and go and seek out some expert instruction. Read a book, watch a video, do a course, go and get a mentor to help you with that specific thing, but not the repertoire of that specific thing. And dear listener, if you know somebody, or if you are somebody who's interested in learning all of those skills to a high level, you will find all of that in our certification in Pilates. We teach that program 100% online. You can do it from anywhere in the world, and it is in 5 modules. And guess what we cover in the 5 modules? The 5 core skills of a Pilates instructor. So it's 20 weeks, 4 weeks per module. And I will put in the show notes, there's a link to a video explaining the whole program to you and how it works and how we'll help you learn all of those skills. So if that's of interest to you, or if it's of interest to somebody I'll be very grateful if you would share that with them. So thanks so much for participating, those of you live. Thanks to you in the Pilates stratosphere for listening. Hope you find this helpful. I'd love to have your feedback and your comments, your thoughts. Am I on the mark, off the mark? Does this ring true in your experience? Where do you feel the gaps are for you? You can DM me on social media, or just hit a comment to wherever you are watching or listening to this. All right. Much love, and I will see you in the next one.